4 weeks ago, I had 13 COVID patients in our hospitals. Today, I have 64. That's a six-fold increase in the number of people admitted. 95% of my beds are full. 250 of my workers today at ThetaCare team members did not show up for work. And it is not because they're getting infected while they are at work. It is because after a nurse has spent 12, 14 hours doing what she does, or a physician or another provider, we go out, and if everybody is not masking, you get infected or you get exposed to something in the community, and then they cannot come back to work and take care of people. Why it is important is because it is not only that we have to ensure that we are there to take care of the patients who have COVID within our communities, but we also have to continue to ensure that we are there for all the other things that people receive in the community as well. So we are still having people who could potentially have a heart attack, and we need to be there for them. And people who have strokes, and we need to be there for them. And people who develop a traumatic process, and we need to be there for them. And we need to be there for the women who need to get mammograms, and the kids who need to be immunized. And so if our people and team members are going to get infected and they're not going to be able to do the work that they need to do to serve the people of our community, then it creates a very difficult situation for us. So sometimes it's not just the number of beds that are available, it's also the people that actually serve the people in that bed. The other thing that I would say is the answer to taking care of these people who have developed COVID or are developing COVID is not to have more hospital beds, as the governor said. The way we actually can answer this problem or create a solution is by keeping ourselves more safe, by doing the simple things that may be aggravating at times, that may be difficult at times, the masking, the social distancing, not gathering in large numbers, now going into the flu season, making sure that we get the flu shot, making sure that you're keeping distance from somebody who may have symptoms, making sure that we are not having sleepovers, for example. All of those things contribute to the number of cases that we are seeing in our communities. And as the governor said, this is really a responsibility that we all have to take very seriously, because if some of us do it and others don't, it doesn't work. We all have to play a part. And my appeal to the people of Wisconsin, the leaders, and each and every individual would be, let's do our part, not only to keep us safe, but to keep our loved ones safe and to keep our communities safe.